Okay, let's unpack this. Turmeric. It's that golden spice that it's gone so far beyond just the spice rack. You see it everywhere now.
Oh, absolutely.
Yeah.
It's in curry powder, of course, but now it's in those golden lattes. It's in high-end supplement capsules. It's everywhere.
And it has been used for literally millennia, right,
Yeah.
in Ayurvedic and traditional medicine. But the sheer volume of modern scientific research around its active component, curcumin, it sort of suggests it's a panacea for everything.
And that's the big question we need to tackle. Is all that hype actually backed by hard science?
Exactly. Is it a miracle molecule? Is it just a mild spice? Or is it, something powerful in between?
It is definitely something in between, and frankly, it's far more complex than most people realize. For this deep dive, we took a massive stack of the most rigorous sources available.
Yeah, we're not just looking at single lab studies here.
No, we're looking at recent, high-quality meta-analyses, systematic reviews, and randomized controlled trials. We want to know what the unified body of clinical data actually says.
So our mission today is, well, it's pretty straightforward. We want to give you a shortcut to being truly well-informed on curcumin. We need to figure out the precise mechanisms of action.
Where the evidence is strongest, and maybe most importantly, how to actually use it effectively.
Right. And to do that, we're focusing only on these really well-established, trustworthy resources. We're going to be using the confidence ratings from the grade system, so you know exactly which claims are rock solid and which are, still a bit speculative.
Exactly. We have to separate the idea of just sprinkling a little yellow powder onto your food from the clinical reality of what it takes to achieve a systemic therapeutic change.
And that brings us immediately to what is probably the single biggest hurdle.
It's a challenge so fundamental that if you don't solve it, the rest of this conversation about all the benefits is, well, it's essentially moot.
I think this section is probably the most important thing for you to understand. Because if you go out and buy a $50 bottle of standard curcumin extract, you really need to know why it likely won't work as advertised.
All right, we're talking about bioavailability.
Bioavailability, it's the major inescapable roadblock with curcumin.
It is. Curcumin, in its native form, right out of the turmeric root, is naturally lipophilic. That's a technical term, but it just means it loves fat and completely resists dissolving in water.
And our digestive system is mostly water, right?
Precisely. So when you consume it, it enters the gastrointestinal tract, and it just doesn't want to be absorbed. On top of that, it gets metabolized incredibly quickly.
Okay, what does that rapid metabolism actually entail? What's the body doing to it?
It's a very fast detoxification process. It happens mainly in the liver and the gut lining, primarily through processes called glucuronidation and sulfation.
So the body is basically tagging the terpenin molecule to get it out of the system as fast as possible.
That's a perfect way to put it. It's tagged and escorted out. Because of this poor absorption and super fast elimination, the plasma levels you get from just eating dietary turmeric are, well, they're vanishingly low.
We're talking less than 1% absorption into the bloodstream.
Often, yes. Less than 1%.
So if I just start loading up on turmeric powder in my food, am I just giving myself very yellow urine and not getting any real systemic benefit?
That's pretty much it. You're stating everything, including your gut, but you are not achieving the blood concentrations needed to interact with cell signaling pathways, like NF-kappa B, on a systemic level.
So the research is clear on this then?
The research confirms that to achieve the therapeutic blood levels you see in successful clinical trials, formulation is the single most critical factor. Nothing else comes close.
Let's put some numbers on that. What does that mean in terms of, say, raw powder?
Okay, consider the raw material. The concentration of the active curcuminoids in a whole turmeric root is only about 2 to 5%. That's it.
That's a lot lower than I think most people would assume.
It is. So to hit a common therapeutic dose used in the trials, let's say 1,000 milligrams of pure curcuminoids, you would need to eat 20 to 50 grams of plain whole turmeric powder every single day.
Wait, hold on. 20 to 50 grams. What does that even look like?
It's roughly equivalent to scooping up a quarter cup of that bright yellow powder and just eating it daily.
No one is doing that. The side effects would be, well, perpetually stained clothes, for one.
Massive gastric distress, a very confused gut microbiome.
Yeah.
It's completely impractical and, at the end of the day, ineffective for systemic benefits. And that's why this conversation has to move immediately to enhanced delivery systems.
Okay, here's where it gets really interesting for me, because science has clearly figured out how to bypass this biological limitation. Let's look at the proven potency enhancers that bridge that gap between a simple culinary spice and a clinically effective supplement.
The first, and definitely the most accessible solution, is piperine.
That's the stuff from black pepper.
Exactly. It's the alkaloid that gives black pepper its pungent kick. This is the most common compound you'll see co-administered with curcumin, and for a very good reason.
How does it work?
Piperine works by directly inhibiting the enzymes involved in that rapid metabolism we talked about. Specifically, it blocks the glucuronidation process in your liver and intestines.
So it's like it's slowing down the body's natural defense mechanism against the curcumin. It's holding the door open longer.
That's a great way to think about it. It creates a temporary bottleneck in the elimination process. This delay gives the curcumin molecule a much longer window to be absorbed and to stay active in the bloodstream.
And the result is a pretty dramatic increase in bioavailability. We're not talking about a small bump here. The numbers are pretty astounding.
They really are. The clinical studies consistently show a massive increase in absorption, up to 2,000%.
2,000%. That's a 20-fold increase in serum concentration.
A 20-fold increase, yes. And that's just from co-administering it with a tiny dose of piperine, usually just 5 to 20 milligrams. It's the most economical and effective foundational solution, and you see it used widely in the scientific literature.
But the technology doesn't stop with pepper, right? I mean, the most successful, high-impact clinical trials often use these next-generation, almost high-tech, specialized formulations that achieve even higher bioavailabilities.
That's right. These formulations are designed to overcome that water solubility issue. They deliver the curcumin in a structure the body recognizes as something it wants to absorb, usually a fat-based carrier.
So like a Trojan horse made of fat.
A good analogy. The first major category here is phospholipid complexes, which you'll often see under trade names like Mariva, or just called phytosomes.
Okay, what's happening there?
In that process, the curcumin molecule is complexed with phosphatidylcholine, which is a key component of our own cell membranes.
So by wrapping it in a structure that looks like our own cell walls, the body is basically tricked into absorbing it much more efficiently.
Precisely. This lipid complex significantly boosts blood levels. The data shows absorption increases up to 29-fold compared to just unformulated curcumin.
That's already a huge improvement.
It's a massive improvement. It allows researchers to use smaller oral doses to achieve those really important systemic effects.
That is already a staggering improvement over the basic powder, but you mentioned even more advanced systems. The highest absorption numbers come from these.
Yes, the frontier here involves nanoparticles and micelles. You might see names like Nano-curcumin or technologies like Novasol. They use liquid micellar delivery or solid lipid particles.
So what are these technologies doing?
They create extremely small, water-dispersible structures that encapsulate the curcumin. Their tiny size and unique structure let them get absorbed directly into the lymphatic system or through the gut wall at an incredibly efficient rate. The numbers here are just huge. One noted a 185-fold higher absorption than unformulated curcumin.
Wait a second, 185-fold? That sounds less like a supplement and more like a science fiction drug delivery system. How do we even trust a figure like that?
It's a critical question.
And more importantly, do those fold increases actually translate into a meaningful clinical difference for the average person taking it?
It is a critical challenge to raise. That 185-fold increase refers to something called the area under the curve in human pharmacokinetic data. It's a measure of how much curcumin stays in the blood over time compared to the standard powder.
So this isn't just marketing speak.
No, this is verifiable lab data. And yes, those dramatic fold increases are necessary. They're necessary because they allow therapeutic concentrations of free or unconjugated curcumin to circulate in the blood.
And that free form is the important one.
That's the one that's biologically active. That's the molecule that can actually do the work. These high-tech systems are specifically optimized to maximize that free fraction. We'll talk about why that's so important later, especially for the brain.
So the takeaway here seems pretty definitive. If you buy a standard curcumin supplement without any of these enhancers, piperine, a phospholipid complex, or one of these micellar systems, you are essentially buying a very expensive yellow powder that will mostly just pass right through you.
That is the unequivocal clinical consensus. You must use an enhanced formula to get any kind of systemic benefit.
And one last simple tip.
Furthermore, because curcumin is inherently lipophilic, taking it with any fat-containing meal is always a good idea. Even if you're already using an enhanced formulation, the presence of dietary fat will further improve its uptake.
Okay, so we should probably briefly mention factors that can actively reduce potency, especially for people who are trying to maximize the curcumin in their cooking for general health benefits.
That's a good point. While the clinical effects we're discussing really require supplements, If you are relying on food, you should be aware that high heat cooking, particularly above 180 degrees Celsius or 350 Fahrenheit, can cause significant degradation.
How much are we talking about?
It can often destroy between 27 and 53% of the active curcuminoids. More critically, curcumin is highly unstable in alkaline conditions.
Meaning a high pH.
Right. If the environment, like certain cooking ingredients you're using, or even a very high pH stomach environment, is above a pH of 7, the molecule rapidly breaks down and becomes useless.
So solving the bioavailability puzzle is step one. It's honestly astonishing that science has overcome a 185-fold absorption problem. Now that we know how to get it into the blood in a therapeutic quantity, let's pivot and see what happens when it actually arrives at our cells. So, what does this all mean at a cellular level? Why does this one yellow pigment seem to affect so many different systems, from our joints to glucose control and even our mood?
The consensus here is really clear, and it's been validated over and over by measuring biomarkers in human blood across multiple high-level meta-analyses. The majority of curcumin's vast list of benefits stems from two core, well-documented actions:
Which are?
fighting inflammation and boosting the body's own antioxidant capacity.
Let's start with that inflammation fight. This seems to be the central driver for most of the major benefits we see across the body.
It absolutely is. Curcumin is documented as a potent inflammation modulator, and it does this primarily by inhibiting something called NF-kappa B.
Or NFB. And that's not just one inflammatory marker, is it? It's often called the master switch for inflammation genes.
That's exactly right. You have to think of NF-key as the central control panel for the cell's entire stress and survival response.
Okay, explain that master switch concept a bit more for us.
So when a cell detects some kind of stress or damage or an infection, this NF-key switch gets activated. It gets flipped on. When it's on, it rushes into the cell nucleus, and it tells the DNA to start producing hundreds of different pro-inflammatory molecules.
So it's like a cascade of sirens and sprinklers going off across the entire building.
Perfect analogy. And what curcumin does is it doesn't necessarily turn off the fire itself, the infection or the stress. It cuts the wire to the main control panel. It prevents that widespread cascade of inflammatory molecules from being manufactured in the first place.
And the clinical data confirms this effect by showing measurable, significant drops in the actual molecules that cause inflammation in our blood.
Yes, and this evidence is incredibly robust. Umbrella meta-analyses show consistent and substantial reductions in key systemic inflammatory markers. The evidence for C-reactive protein, or CRP, is particularly strong.
And CRP is a big one.
It's the general barometer of inflammation in the body. The evidence for its reduction is often rated as high-grade certainty. Studies show significant drops in CRP levels across patient groups with inflammatory disorders, often decreasing by 30 to 50% in chronic conditions.
What about those more specific pro-inflammatory cytokines that initiate the cascade? I'm thinking of things like IL-6 and TNF-di.
We see significant and highly consistent decreases there too. The pool effect sizes across many trials show significant reductions in interleukin-6, IL-6, and very notably, tumor necrosis factor alpha, or TNF-1.
And TNF-I is a major driver of chronic inflammatory diseases like rheumatoid arthritis.
It is, and the meta-analyses consistently report reductions in TNF levels. Some of the data suggests a weighted mean difference of around minus 1.92 picograms per milliliter.
Okay, for the listener, what does a reduction of nearly 2 picograms per milliliter of TNF-DAW actually mean clinically? Is that a big deal?
It means we are crossing a measurable threshold of biological dampening. While picograms sound incredibly small, these are really powerful signaling molecules. A persistent reduction of nearly 2 units in TNF-A is the kind of change that can shift a chronic inflammatory state, the kind of state that leads to joint stiffness or vascular dysfunction, back toward a more quiescent, healthy state.
So it's a small number that represents a big biological shift?
Exactly. And the fact that this particular finding often demonstrates the lowest heterogeneity across studies is critical.
Why is that low heterogeneity so important?
It suggests the result isn't just random noise from a few lucky studies. It means it's a highly consistent finding across diverse trials in diverse populations. It's reliable.
That reliability is key. Now, what's fascinating here is the population-specific nuance. You mentioned the anti-inflammatory effect appears to be stronger in older adults.
Absolutely. The effects appear to be significantly stronger in those aged 45 years and older. And this is likely due to a phenomenon of chronic low-grade inflammation that tends to increase with age. Scientists have a term for it: Inflammaging.
Inflammaging. Let's try and use an analogy for that.
Okay, think of a younger person's baseline inflammation level, like a small, controlled campfire that we're trying to put out with a hose. Curcumin helps, but the overall effect size is moderate.
Okay.
Older adults, however, they have a basement that's always slightly smoldering. This is due to decades of accumulated stressors, metabolic waste, and aging immune cells. That's inflammaging. So when curcumin comes in, it has a much larger, more critical, pre-existing problem to solve. NFU is already constantly active.
So it has a bigger job to do, and therefore the measurable effect is more pronounced.
Precisely. Subgroup analyses show that the CRP reduction, for example, is often 3 times greater in the older cohorts compared to younger, healthy groups.
That makes perfect sense. Okay, let's pivot to the second major mechanism, the antioxidant action.
Curcumin is highly effective as an antioxidant booster in 2 distinct ways. First, it actively scavenges harmful free radicals, things like reactive oxygen species, ROS, and reactive nitrogen species, RNS, directly. It helps neutralize acute damage on the spot.
But the more enduring effect comes from strengthening the body's own defenses, right? It's not just doing the work itself.
Precisely. The second, and more enduring action, is that it modulates and enhances the activity of the body's own endogenous antioxidant enzyme systems. It's not just a direct antioxidant, it's a signaler that tells the body to ramp up its own production of defense molecules.
Like what?
It increases the activity of vital enzymes like superoxide dismutase, SOD, and glutathione, GSH.
And glutathione is often called the body's master antioxidant.
It is. By boosting these internal systems, curcumin helps the body manage long-term oxidative stress damage much more effectively. And we can measure this. Meta-analyses confirm that curcumin supplementation significantly reduces a compound called malondialdehyde, or MDA. MDA is a crucial biomarker we use to measure oxidative stress damage, specifically damage to lipids and our cell membranes.
So a reduction in MDA means less cellular decay.
It means the body is successfully limiting cellular decay driven by free radical attacks. So when you put it together, by fighting the master switch of inflammation through NFPB inhibition and enhancing the body's natural defenses against oxidative damage by boosting SOD and glutathione, you get this powerful dual action that really explains its broad systemic benefits across nearly every organ system.
Okay, moving from the cellular level to real-world outcomes, let's look at where the clinical evidence is truly robust. We have to start with joint health, which appears to have some of the strongest and most reliable data in the entire stack.
Oh, this is absolutely where we see high-grade evidence. It's the gold standard. Multiple large meta-analyses of randomized controlled trials consistently confirm that curcumin supplementation significantly alleviates the core symptoms of osteoarthritis, or OA. And what are those core symptoms?
Joint pain, stiffness, and it also improves mobility. And these effects are rigorously measured using validated metrics, like the Western Ontario and McMaster University's Osteoarthritis Index, or OMX scores, and visual analog scales for pain.
For listeners who might not be familiar with WOMAC, what does an improvement in that score actually signify in terms of daily life?
WOMAC is so important because it measures functional limitations. So an improved score doesn't just mean your pain register went down from a 7 to a 5. It means you can actually bend your knee further. You can walk longer without pain. You can navigate a flight of stairs with greater ease.
So it reflects a tangible improvement in quality of life.
A very tangible improvement. The pooled data shows a reduction in WOMAC scores that is consistently clinically meaningful. We're talking a moderate to large effect size, usually exceeding the minimum threshold required for patients to notice a significant difference in their day-to-day function.
I think the most compelling finding here is the head-to-head comparison to conventional pharmaceutical treatments for knee pain. Absolutely. This is what elevates curcumin from just simple supplement to a viable therapeutic alternative. Multiple rigorous RCTs have compared curcuma domestica extract, often at 1,500 milligrams a day, directly against standard NSAIDs like ibuprofen at 1,200 milligrams a day.
And what did they find?
For chronic knee OA pain relief, they found that the curcumin treatment was non-inferior. That means it achieved comparable efficacy in reducing pain scores and improving physical function over periods up to 3 months.
So similar pain relief results, but with a critical difference in the safety profile.
And that is the major selling point that has driven so much of this research. NSAIDs are incredibly effective, but we all know that long-term use is associated with known risks.
Gastrointestinal side effects, stomach upset, ulcers, GI bleeding risk.
Exactly. Curcumin offers pain relief that's comparable to NSAIDs, but with a distinctly better, more benign safety profile. So for patients who are intolerant of NSAIDs or need to manage chronic joint pain without those risks, curcumin provides a really effective, well-tolerated alternative.
And the benefits extend beyond just osteoarthritis, which is more of a wear and tear condition, to other inflammatory joint conditions like rheumatoid arthritis, right?
Correct. We have systematic reviews involving patients with the more severe autoimmune condition, rheumatoid arthritis, and they found significant benefits when curcumin was used as an adjunct therapy.
What did it do for them?
It significantly lowered their clinical disease activity scores, like the DAS-28. It reduced the number of tender and swollen joints. It lowered pain scores, and it decreased key systemic inflammatory markers, like erythrocyte sedimentation rate, ESR, and that C-reactive protein, CRP, we mentioned earlier.
So it's helping to quiet the systemic inflammatory storm that RA causes?
Precisely. It positions it as a powerful complementary addition to standard RA disease-modifying anti-rheumatic drugs.
Okay, for listeners who are considering this for joint relief, what's the effective dosage and maybe more importantly, how long must they commit before they can expect to see results?
Patience is absolutely essential here. The effective dose range consistently cited in these successful trials is high, typically between 1,000 and 2,000 milligrams per day of standardized curcuminoid extracts.
And you'd want to split that up.
Yes, they're usually taken in divided doses, ideally 2 or 3 times a day, to maintain stable anti-inflammatory levels in the blood. And crucially, this is not an acute painkiller that works in 30 minutes. The studies show benefits emerge reliably only after a duration of 8 to 12 weeks of consistent daily use.
Now let's move to a different application. Not someone with a chronic condition, but the healthy, active individual who is seeking an edge in recovery. What's the evidence for curcumin helping with post-exercise recovery, minimizing muscle soreness, and getting back to training faster?
The evidence here is slightly less robust than for chronic OA. We generally give it a moderate grade rating, but the underlying biological mechanisms are very compelling.
So what's happening?
Curcumin demonstrably attenuates the markers of post-exercise muscle damage and acute inflammation.
What are the key biomarkers researchers are looking at to confirm that damage is actually being mitigated?
Well, we're looking at markers of cellular rupture and inflammation, specifically compounds like creatine kinase, or CK, which gets released into the blood when your muscle fibers break down.
And inflammatory mediators, too.
Yes, things like TNF-I and IL-8, which drive that localized pain response. The studies show that curcumin supplementation resulted in significantly smaller increases in these markers following intense exercise, especially eccentric exercise, designed to induce maximum damage.
Can you give us a concrete example of that dampening effect?
Sure. In one study involving highly conditioned athletes like rugby players, high-dose curcumin supplementation noted a 48% smaller increase in circulating CK
Almost half.
and a 25% smaller increase in the TNF inflammatory cytokine compared to the placebo group following a standardized exhaustive exercise protocol. That's solid confirmation that the biological response to that training trauma is being significantly dampened.
Okay, so that shows the biological response is being mitigated. Does that translate reliably to the subjective experience of feeling better faster? Reduced DOMS?
Yes, in many studies involving healthy, active people resistance trainers, cyclist athletes, the reduced biological inflammation often correlated directly with reduced subjective muscle soreness or delayed onset muscle soreness, DOMS.
Lots of thinking there.
The hypothesis is that by mitigating that acute inflammatory burst caused by intense training, you decrease the pain response and theoretically allow the muscle to transition into the repair phase much faster, potentially decreasing the overall recovery time between your sessions.
And what's a specific protocol for using curcumin for recovery? It seems like it would be much different from the high, sustained doses for chronic pain.
It is. The dosing for recovery is generally lower, and it's highly focused on the period immediately surrounding the stress event. We see doses of around 150 to 500 milligrams of a high bioavailable form.
And when do you take it?
It's taken consistently in the 2 to 3 days immediately before and the 2 to 3 days immediately after an intense exercise session or competition. It's used more strategically to preemptively suppress that inflammatory response.
Okay, this might be the most globally important application because it addresses metabolic dysfunction, which is often this silent contributor to almost every chronic disease. We're talking about curcumin's influence on glucose regulation and cardiovascular health.
The evidence for improving glucose control is incredibly consistent across the literature. It's often rated as high-grade in large meta-analyses, especially when you look at fasting blood glucose and insulin resistance scores.
So what are the specific parameters that show the most reliable improvement?
Curcumin provides a modest but a highly consistent improvement in glycemic profiles across patient groups with metabolic syndrome, obesity, and established type 2 diabetes. The most impressive data is consistently on fasting blood glucose, or FBG, where the meta-analyses show significant reductions.
And what about insulin resistance?
For insulin resistance, which we measure with HOMA-IR scores, our sources show that all of the identified meta-analyses demonstrated a reduction, 100% concordance.
HOMA-IR is a term many people have probably heard but might not fully grasp. What is it, and why is its reduction so important?
HOMA-IR stands for Homeostasis Model Assessment of Insulin Resistance. It's essentially a numerical score that's derived from your fasting glucose and your fasting insulin levels.
And what does it tell you?
A high score means your body is pumping out a lot of insulin, but your cells aren't listening. That's insulin resistance, the primary driver of type 2 diabetes. The fact that 100% of the studies showed a HOMA-IR reduction strongly indicates improved insulin sensitivity. It means the cells are opening up and utilizing glucose more effectively.
It's not just acute glucose management either. We see effects on the long-term markers of blood sugar control as well.
Correct. There are consistent reductions in glycated hemoglobin, or HbA1c, which reflects your average blood sugar control over the preceding 3 months.
What are the mechanisms behind this?
They're complex, but they include improving the efficiency of the insulin signaling pathway and enhancing the secretion of adiponectin, which is a beneficial hormone involved in regulating glucose and lipid metabolism.
But the finding that truly elevates this topic from simply modulating biomarkers to preventing major disease is that landmark prevention trial that was done in pre-diabetics.
This trial is critical for contextualizing the clinical weight of curcumin. It was a 9-month randomized controlled trial focused specifically on patients who were already diagnosed with prediabetes.
And what was the intervention?
They were given 750 milligrams per day of curcumin, and the results showed it significantly reduced the progression rate of prediabetes to full-blown type 2 diabetes.
What was the clinical significance of that finding? How big was the effect?
The study yielded a very compelling statistic called the number needed to treat, or NNT, of 7.
Explain NNT for us.
NNT is a measure of efficacy. It means that only 7 people had to take the curcumin supplement for 1 person to avoid developing type 2 diabetes over those 9 months.
To put that into perspective, an NNT of 7 is an incredibly strong number for a supplement in disease prevention. That's comparable to some pharmaceutical interventions.
It is, and it really solidifies curcumin's role as a tool for disease prevention, not just a dietary aid. This data moves it out of the realm of maybe it helps a little bit and into this has a statistically significant and clinically meaningful impact on preventing a major chronic disease.
Okay, beyond blood sugar, curcumin is often discussed in the context of weight management and cholesterol. What do the rigorous studies show for these anthropometrics and lipids?
The effects on anthropometrics are generally modest in magnitude, but they are consistently detectable across the body of evidence.
What kind of populations are we talking about?
In patient populations with metabolic syndrome or obesity, curcumin showed small but consistent reductions in body mass index, BMI, overall weight, and waist circumference. The standardized mean differences typically range from -0.2 to -0.4.
An SMD of -0.2 or -0.4 is considered a small to moderate effect size, correct? How should a listener interpret that?
That's right. It means it's definitely not a dramatic weight loss drug, but it is a consistent modulator. The studies suggest that curcumin is likely helping by modulating the body's fat tissue behavior.
How so?
It favorably altered adipokines, those are the hormones released by fat cells. Specifically, it decreased the pro-inflammatory hormone leptin and increased the beneficial hormone adiponectin, which is favorable for improved metabolic health and fat burning.
And for blood lipids, total cholesterol, LDL, HDL.
The meta-analyses show a reliable and consistent reduction in total cholesterol, or TC, and triglycerides, or TG.
What did the numbers look like there?
For example, one large umbrella review reported an average reduction in total cholesterol of approximately -7.76 milligrams per deciliter and a strong triglycerides reduction averaging -13.15 milligrams per deciliter.
That reduction in triglycerides is especially welcome since high TG is a major cardiovascular risk factor.
It is. But what about the famously confusing LDL and HDL numbers?
That's what I was going to ask.
Changes in LDL-C, the so-called bad cholesterol, and HDL-C, the good cholesterol, are more modest or mixed. They often show high statistical heterogeneity across the studies.
What does that mean?
It suggests that while curcumin reliably handles the total burden of lipids and triglycerides, its effect on the specific LDL-HDL fractions might be less direct or more dependent on the patient's underlying diet, their genetics, or even regional factors.
Interesting.
We did note that some subgroup analyses suggested regional differences, with Asian cohorts showing stronger effects than Middle Eastern cohorts for certain lipid parameters, which highlights that genetic or habitual dietary patterns might modulate the response.
Finally, let's touch upon the cardiovascular benefits related to vascular function, which precedes overt heart disease.
Curcumin modestly but definitively improves endothelial function. That's the ability of your blood vessels to properly dilate and constrict. This elasticity is key to vascular health.
And we have good data on this.
Yes, one very well-conducted 12-week RCT in healthy older adults found that 2,000 milligrams per day of a high bioavailable formulation significantly improved endothelial function, measured by flow-mediated dilation, or FMD, by approximately 36%.
Explain FMD for us.
FMD measures how much your artery expands when blood flow is abruptly restored after a temporary restriction, like from a blood pressure cuff. It is a non-invasive way to assess the health of the endothelium, the inner lining of your blood vessels.
And a 36% improvement is a big deal.
It's highly significant because poor endothelial function is an early predictor of atherosclerosis and cardiovascular disease. The mechanism here appears to be linked to increased nitric oxide bioavailability and, again, reduced oxidative stress within the vascular tissue itself.
And we have some emerging data specifically concerning blood pressure, too.
Yes. While the general effects on blood pressure are often mixed across all populations, one specific RCT focused on hypertensive patients under the age of 65. It suggested that a high absorption form of curcumin at 180 milligrams a day might suppress B-type natriuretic peptide, or BNP.
And why is BNP important?
BNP is a biomarker associated with cardiac hypertrophy. That's the undesirable thickening and enlargement of the heart muscle. So this suggests curcumin may offer a potential preventive mechanism against hypertensive heart disease, particularly in younger patients where high blood pressure is just beginning to take a toll on the heart structure.
We've covered the entire body, from joints to metabolism. Now let's explore the brain. This is where things get a bit more complex, where the evidence for general cognitive enhancement is often weaker, but for mood, it's actually incredibly promising.
This is a fascinating area because the brain is so highly protected, and the only way to achieve benefits is to really solve that delivery challenge we talked about right at the start.
Let's start with mood, which has garnered a lot of attention in recent years.
Indeed. The evidence base here is rated as moderate grade for improving depressive symptoms, and it is pretty compelling. Multiple meta-analyses of RCTs report that curcumin, used either as an adjunct to standard antidepressant therapy or sometimes as a monotherapy, significantly improved symptoms.
What kind of effect size are we seeing for depression compared to, say, a standard antidepressant?
The pooled effect sizes are reliably moderate. You're seeing standardized mean differences, or SMDs, ranging from minus 0.34 to minus 0.75, favoring curcumin. An SMD of minus 0.75 is considered a robust effect in clinical nutrition trials. It suggests a strong clinical impact on measured depression scores.
What about anxiety?
Anxiety symptoms also decline modestly, with some meta-analyses reporting effect sizes as large as a Hedges G of minus 2.62.
That is a substantial effect, particularly for an over-the-counter nutraceutical. Who is benefiting most in these trials? Who is this for?
It seems that curcumin may be particularly beneficial in patients whose depression is complicated by a chronic illness, or for those who present with higher baseline inflammatory markers.
So this connects directly back to that NF-kappa B mechanism we talked about.
Exactly. We now understand that inflammation and certain types of depression are inextricably linked. The brain's immune system can be overactive. By quieting systemic inflammation, curcumin may be reducing a key driver of that depression.
And what are the other mechanisms aside from just inflammation?
The benefits are also tied to its neurotrophic effects. Curcumin is involved in supporting the health and survival of our neurons. Specifically, studies have shown that curcumin supplementation increases serum levels of brain-derived neurotrophic factor, or BDNF.
And BDNF is often called brain fertilizer, right?
That's a good analogy. BDNF plays a critical role in memory, learning, and mood regulation. Lower levels are commonly found in depressed patients, and many standard antidepressants work, in part, by increasing BDNF.
So curcumin helps boost this natural production.
It does. It also appears to modulate the HPA axis. That's the body's stress response system, resulting in lower circulating cortisol, which is often elevated during chronic stress or depression.
For this specific purpose, what does the research say about dose and duration?
Consistent use is key. The successful dosing typically falls within the 500 to 1,000 milligrams per day range of a standardized extract, and it needs to be taken consistently for a minimum duration of 4 to 12 weeks.
Okay, this is where expectations need to be heavily managed. If curcumin has such profound anti-inflammatory and neurotrophic effects, why isn't the evidence for general cognitive enhancement stronger?
That is the pivotal question. And it all comes back, once again, to the bioavailability problem, but amplified by the difficulty of crossing the blood-brain barrier.
So what's the rating here?
Overall, the evidence strength for global cognitive function is rated as low inconsistent grade. Systematic reviews in generally healthy older adults found no significant overall effect on global cognitive scores when using typical or standard formulations.
So why is the blood-brain barrier, the BBB, such a major hurdle for curcumin?
For curcumin to exert a robust therapeutic effect on brain health, it has to cross that highly selective barrier and actually reach the neurons. Most of the curcumin circulating in your blood after you take it orally, even with a piperine enhancer, is the conjugated form.
That's the form the body has tagged for elimination.
Exactly. And this conjugated form is polar, meaning it's water-soluble, and it's too large to easily cross the fatty BBB. Only the free or unconjugated curcumin molecule is typically small and fat-soluble enough to sneak across and interact with neural tissue.
So if the formulation doesn't achieve high levels of that free form, the brain simply doesn't get the therapeutic dose it needs.
Precisely. This highlights the absolute necessity of using those third-generation high bioavailability formulas we talked about. They're specifically designed to keep a larger fraction of the curcumin in that fat-soluble unconjugated state.
But are there glimmers of hope in specific cognitive areas? Does it help with anything?
Yes. Despite the weak overall score, subgroup analysis does reveal that certain cognitive domains show mild positive effects, specifically working memory and processing speed.
So what does that suggest?
It suggests that perhaps these functions are less dependent on the massive concentrations required to treat something like a severe neurodegenerative disease, and they're more sensitive to the low-level anti-inflammatory support that curcumin can provide. One meta-analysis showed a small positive SMD of approximately plus 1.01 for working memory tasks.
Do we have trials that show the superior formulation strategy actually works for severe cognitive disorders like Alzheimer's?
We have some very promising emerging data that proves the concept. There was one highly publicized 6-month RCT that used a specialized third-generation high-absorption formulation. It's a galactomannoside complex called curfin.
And this was in Alzheimer's patients.
In patients with moderate Alzheimer's dementia. This trial showed a significant improvement in their MMSE scores, which is a standard cognitive test. And crucially, it reduced pathogenic biomarkers in their spinal fluid,
Like what?
specifically amyloid 42 and phosphorylated tau protein, while also increasing that all-important BDNF.
That's a game changer if it holds up.
It is. This single trial strongly suggests that the clinical effectiveness of curcumin in the brain hinges entirely on the delivery system's ability to cross the BBB. If the delivery system is right, the mechanistic effects, the anti-inflammatory, the neurotrophic, can translate into clinical outcomes even in severe conditions.
Finally, we have to address the ultimate claim: longevity. Everyone wants to live longer, and since curcumin fights so many mechanisms of aging, the leap is often made.
That leap is premature, and the longevity claim must be qualified as very low grade. It's purely speculative.
Why so low?
Because there are 0 human randomized controlled trials that directly measure lifespan. You can't do that study. The claims are based purely on weak observational data, like the association between regular curry consumption and better cognition in elderly Asian populations, or on improved biomarkers of aging, like reduced systemic inflammation and oxidative stress.
So what can we say confidently?
We can confidently say curcumin helps mitigate biological processes like inflammation and metabolic dysfunction that drive age-related chronic diseases. It supports a longer health span. But we simply lack the multi-decade human lifespan trials required to prove it extends life.
Okay, to wrap all of this up, let's distill this comprehensive evidence into clear, actionable guidance on dose, timing, and most importantly, who needs to be cautious because of drug interactions.
For therapeutic dosing, you should be looking for products that contain between 500 and 1,500 milligrams per day of standardized curcuminoid extracts. And that standardization is key.
It should say 95% curcuminoids or something similar.
Yes, that ensures you're getting the active molecule and not just ground up turmeric filler.
And we simply cannot stress this enough, the necessity of the formulation. If you forget everything else we've said, remember this one point.
Absolutely. For any systemic effects, and that means any benefit outside of simply acting as an antioxidant in your gut, the use of a high bioavailability formulation is non-negotiable.
So that means choosing products that explicitly state they have an enhancement with piperine, which is usually 5 to 20 milligrams.
Or opting for a phospholipid complex, a phytosome, or one of those advanced micellar or nanoparticle formulations which achieve the highest blood levels in the clinical trials.
And what's the best way to schedule the dose throughout the day?
Divided doses, so 2 to 3 times daily, are highly recommended. This strategy is critical to maintain stable blood levels, which is especially important if you're managing a chronic condition like arthritis, depression, or persistent metabolic inflammation.
And always with food?
Always take it with food that contains some fat. This remains the most basic, fundamental way to enhance absorption. And finally, remember that patience is key. The effects typically emerge only after 4 to 8 weeks of consistent daily use. Don't expect immediate results.
Okay, given the consistency of the research, who are the best candidates who can expect the most reliable benefits? I mean, who should be investing in this supplement?
The best candidates are definitely adults dealing with chronic inflammatory conditions. So osteoarthritis, rheumatoid arthritis, also patients with metabolic syndrome, prediabetes, or established type 2 diabetes,
And for mood?
and individuals struggling with mild to moderate depression. And the data consistently shows the strongest anti-inflammatory responses in older adults, specifically those aged 45 years and above, likely due to their higher baseline inflammaging levels.
What about the gaps we found regarding demographics or regional differences? Are there people this might not work as well for?
It's important to note the limitations. Most high-quality trials have historically focused on middle-aged to older adults, and often within Asian or Middle Eastern cohorts, given the traditional use of the spice.
So we don't have as much data on other populations.
Right. Data on specific gender differences in response is sparse, though the studies do confirm efficacy in both men and women for the major conditions like arthritis. We did, as we mentioned, note some metabolic effects, particularly LDL-C changes, showing regional differences between Asian and Middle Eastern populations. This suggests genetics or habitual diet may influence the response, and that's an area that needs far more research.
Curcumin is widely perceived as being very safe. Is that reflected in the clinical trial data, even with these high-dose, high-absorption formulas?
Yes, the safety profile is excellent. Curcumin is generally recognized as safe, or a GRAS, by the FDA. It's very well tolerated in clinical trials, even at high doses, up to 8 to 12 grams per day of the raw powder equivalent.
And what about side effects? What should people look out for?
Any side effects are typically mild, and they're limited to the gastrointestinal tract, things like transient nausea, diarrhea, or maybe some reflux. And these are usually only reported at the absolute highest doses or sometimes with certain lipid-based formulations.
Now for the critical warnings. The safety profile changes significantly if the patient is taking certain prescription medications. This is paramount for our listeners to understand.
This is a non-negotiable point for anyone on prescription drugs. Curcumin has mild antiplatelet effects, and it can also inhibit certain metabolism enzymes in the liver, specifically some of the CYP450 enzymes.
Which mean?
Therefore, concurrent use with prescription anticoagulants or antiplatelets, things like warfarin, aspirin, or clopidogrel, carries a real risk of increased bleeding.
Can you elaborate on the warfarin and INR risk? Because that's a big one.
Because curcumin inhibits some of the enzymes that metabolize warfarin, it can potentially increase the concentration of the drug in the bloodstream. We have case reports that confirm curcumin supplementation can elevate the international normalized ratio, or INR. That's the measure of blood clotting time in warfarin patients.
So that could be very dangerous.
It could require dose adjustments, or it could just increase the overall bleeding risk. Medical supervision and rigorous monitoring are absolutely essential here.
What other medication classes require caution?
Diabetes medications are the second major class because curcumin consistently reduces blood glucose and improves insulin sensitivity, as we saw with the FBG and OMA-IR data. Taking it alongside standard diabetes drugs like metformin, S-use, or insulin creates a potential additive hypoglycemic effect.
Meaning their blood sugar could drop too low.
Exactly. Patients need to monitor their glucose very closely, and their doctor may need to adjust the dosage of their diabetes medication downward.
And finally, a note for anyone anticipating a medical procedure.
Due to that mild antiplatelet effect, the tendency to slightly thin the blood, it is critical to discontinue high-dose curcumin supplements at least 2 weeks prior to any elective surgery.
And one last contraindication.
And lastly, due to its ability to stimulate bile production and contraction of the gallbladder, high doses should be avoided entirely in patients with an existing bile duct obstruction or active gallstones.
That provides a clear, evidence-based roadmap built entirely on high-confidence data.
So to summarize the key takeaways, the evidence base, which is driven by these high-quality meta-analyses, strongly supports curcumin as a safe, effective adjunct therapy. It's especially useful for conditions driven by chronic inflammation, osteoarthritis, metabolic syndrome, and mild to moderate depression.
But with a big asterisk.
A huge asterisk.
Yeah.
Provided you commit to using a high bioavailability formulation and you maintain realistic expectations of small to moderate effects that are going to take weeks to fully accrue.
We established that curcumin works primarily by modulating NFP, that crucial inflammatory switch, and boosting antioxidants across the body. Given the consistent evidence that curcumin powerfully benefits patients who already have existing chronic inflammation, we are left with this final provocative thought.
If the core mechanism of curcumin is mitigating age-related chronic inflammation, the question is not whether it works on joint pain or glucose, but whether mitigating chronic inflammation is, in fact, the key to extending not just our lifespan, but our health span.
The number of years we live free from chronic disease.
Exactly. Even if we still lack the multi-decade human data to conclusively prove a longer life. That is the ultimate implication of maximizing the potential of this golden spice.